Most people don't know that this little muscle right here, which is often overlooked and not tested when we see a doctor, is frequently a hidden cause. Low back pain, SI joint pain, and even hip pain. And since no one is assessing or teaching you about it, you continue in pain. In this video, I'm going to help you understand all about this muscle and give you a simple test you can use at home to see if yours is weak. And then I'm going to teach you the best ways I know to quickly strengthen it so your body can be balanced and you can get out of pain. I'm Dr. Brant Pedersen, and in the past 20 years, I've helped countless patients identify and remedy this problem. In fact, when a patient comes into my office with low back, SI joint, or hip region pain, it is a vital part of the patient examination. We never miss testing. I'm going to show you how we use this high-tech tool here to do just that in a bit. But first, let me introduce you to this muscle and show you why it is so important. This muscle right here is called your gluteus medius, or glute med for short. And it's part of your gluteal muscle complex around your hip and pelvis here. And it's sandwiched between your glute max, which is the most famous glute muscle, and the glute minimus, which runs underneath your glute medius. And like a middle child who can get lost in a family, the glute medius is usually not tested. And when it is weak, it can cause real issues. Let's talk about why. The gluteus medius has two actions. One that seems obvious, raising your leg out to the side like this. But its second action, and the most important function that it has, is actually stabilizing your hip and your pelvis, keeping your pelvis level as you walk, run, and even when you're standing. For example, when you're walking, you have both feet on the ground only about 30% of the time. Most of walking is actually a one-legged activity. And that 30% figure is actually a measure that's called the double support time. A lower value means you're spending more time on one foot instead of two. And so a lower percentage can be a sign of better balance and stronger glute med muscles. If you're curious what your double support time is and you have an iPhone, you can find it under the Health app, Summary tab, click on the Show All Health Data, and then scroll down to double support time. Unfortunately, I haven't figured out how to get this data on an Android device, but if you know, please share in the comments down below. But back to the glute medius. So now you can see the majority of walking is a one-legged activity. And when you take one of your two supports away, your body should fall towards that side. But it doesn't because of your glute medius muscle. Your glute med pulls down on your pelvis opposite the leg that is swinging, which keeps your pelvis level, or at least it should. If your glute medius is weak, then your pelvis drops towards the leg that is swinging. This puts lateral stress on your hip because walking should be primarily a flexion and extension activity. And over time, this can lead to hip arthritis and bursitis. And your sacrum, which is this triangle-shaped bone at the bottom of your spine right here, it should be a level base for your spinal bones. But when your gluteus medius is weak, it allows your pelvis to tilt and therefore your sacrum to become unlevel, which can cause SI joint pain and also pain into your low back. But the good news is that if your gluteus medius is weak and you strengthen them, it helps correct a big part of the underlying cause and risk factor for these conditions. So how can you test to see if your gluteus medius muscles are weak? I'm going to teach you a simple method you can do right now wherever you are. But first, let me quickly show you how we measure glute med strength in our office. We use a handheld strain gauge to get a digital measurement of our patient's exact glute medius strength. The value considered strong, where the gluteus medius is providing all the function it needs to, is 35% of a patient's weight. Here's a table showing that 35% figure for different body weights. When we do this testing, it's more common than not to find that people are below the 35% strength ratio. And many times in a patient with chronic low back pain or SI joint pain or hip region pain, they've seen tons of people, they can't get it fixed. It's been there for months or years. I'll find this value under 20%. I've even seen it as low as 10%. In patients like these, if we don't get the glute med strengthened, it's hard for us to ever get them out of pain. But determining if it is weak is the first step. If you don't have a digital strain gauge, you can try this method to easily assess your gluteus medius strength. It involves standing on one leg, so if your balance is questionable, you should do it in a space where you can hold on to something sturdy or have someone else help you so you don't fall. To do this assessment, you're going to stand on a flat level surface and put your hands on your hips. It's okay if you want to hold on to something very lightly for balance. With your hands on your hips, you're going to simply bring one leg up off the ground until your thigh is parallel to the floor. How's that feel? Does it feel like your pelvis dropped or stayed level? This is part of the reason we got our hands on our hips, is to assess if one of our hips is dropping downwards. Did you feel like you had to shift your body weight over the stance leg? Now try it on the other side. Do you notice a difference from side to side? Does one side feel more stable and the other side harder to balance? You might also notice that your hip on your stance leg wants to jut out to the side. This is because your glute medius is giving up or having a hard time maintaining the contraction. So the things that we're looking for in this assessment is a hard time maintaining a level pelvis, your hip jutting out towards the side of your stance leg, feeling unstable or like you need to put your foot back down, or shifting or centering your body weight over the top of your stance leg instead of just being able to pick your leg up. If you have some of these indications, then the probability is that you have weakness in one or both of your glute medius muscles, and the exercises I'm going to show you now can be beneficial. So by this point, you've learned why the gluteus medius is so important and can be tied into so many areas of pain. And hopefully you've assessed your glute med strength and you might feel like one or both of your glute meds are weak. Now let's get to the fun part. Let's learn how to start strengthening them. I'm going to give you 3 simple exercises that you can do at home without any equipment. However, YouTube is a one-way medium and I can't see or assess how you are doing or if any of these exercises are appropriate for you. It is important for you to check in with your healthcare provider and, as always, listen to your body. No exercises like this should cause pain during or after doing them. You may have muscle soreness afterwards as you are strengthening things, but you shouldn't have pain. These 3 exercises are the main starting point I use with most of my patients who have glute med weakness. That being said, you may want to start with easier exercises first, or you may want to progress to more difficult exercises targeting your glute med. I've included links to both of those videos here and in the video description below for when you're ready. Also, I know sometimes people like to have a PDF handout that lists the exercises, key points to follow, all the details, and I've included a link of that down below in the show description. I'll also summarize the sets, reps, and daily program I prefer at the end of this video. Okay, let's get started. This first exercise is a standing lateral leg raise. And this exercise is amazing because you're going to be targeting both of your gluteus medius muscles at once, isometrically with your standing leg and concentrically with your leg that is moving. To start with this exercise, I recommend doing it in a place where you can stabilize yourself if you lose balance, like in your kitchen where you can hold onto your countertop if you need to. You're going to be standing on one foot and then while keeping the other foot facing forward or slightly inwards for extra credit, you're going to slowly bring your leg out to the side as far as you can while continuing to stand straight up and also keeping your pelvis level. Put your hands on there so that you know that you're keeping it level or as level as possible. It doesn't matter so much how high you get your leg, but you want to make sure you're not compensating by rotating your foot outwards. That'd be using your quad for this exercise, or by leaning your body to the side, or by leaning forward at your waist. So you want to make sure that you can do this motion, maintaining your balance, bringing the foot out to the side, and not compensating. A little bit of leaning to the side with your torso is normal as a counterbalance, but we don't want to see you doing this motion. I usually have my patients do 3 sets of 8 reps of this exercise, but it all depends on the starting point as far as the gluteus medius strength. The key to gaining strength in your glute med is consistency. Reps don't matter as much as showing up. So don't overdo it this first time. Just learn the motion, show up tomorrow, and let's do it again. Where you should feel this exercise is right here. This is your gluteus medius region. So you should feel it on the leg that you are moving, but you should also feel it on the stance leg because that is having to keep your pelvis balanced as you move. After you've done 8 reps on one side, then you can switch legs and move to the other side. A bonus of this exercise is that it is working your core muscles to maintain your posture upright as you stand on one leg. Man, flamingo sure makes standing on one leg look easy. If this first exercise feels like a bit too much standing, you can take it to the floor or to your bed. When you take it to a floor, you can take your bottom leg and bend it up a ways to give you some stability. You're going to want to make sure that your hips stack on top of each other and that your foot, knee, hip, and shoulder all are in one line. Then I'm going to internally rotate my foot and slowly bring my leg up and down like this. This is a totally fine variation to do if it felt like the one standing is a little bit too aggressive this time. The second exercise is one you might have seen before, but I'm going to help you understand a few key elements that can really bump up its effectiveness. And this exercise is great because it can be done in bed or on the couch, so there's no excuse for not getting it done. The second exercise is called the clamshell. To do this exercise, we're going to lie down on our side. Our hips are stacked on top of each other. We're going to put both of our legs on top of each other. And then what we're going to do is slowly open up, like we were a clamshell here with our legs. Slowly open up as far as we can. The trick to making it a lot more effective is to pretend your thigh here, that you're rotating it externally, like this. You should really feel that contraction in your glute when you do that motion, when you try to rotate your thigh this way. We want to make sure that we stay stacked on top of ourselves here at our hips so that we're not rotating backwards with the motion. And we just want to make this a slow and controlled motion. You might notice that you have a jerkiness as you move. That is the muscle showing that it's weak, but you're working on that and you're going to increase its strength. I like to do 10 reps of this exercise and then switch to the other side and do 10 more, doing 3 sets total. If this exercise gets where it feels too easy, you can take a band and put it around your knees, a little bit above your knees, and then slowly open up against that resistance. This is how you take that to the next level. If it feels like you can't move very far, you can't open up wide, don't worry about it. Just do what you can do, and you're still getting a contraction of your external hip rotators and your gluteus medius with this exercise. This last exercise looks deceptively easy, but it really helps strengthen your gluteus medius muscles in a different way than the last 2 exercises. If you'll need a pillow or a couch cushion, maybe a folded up towel, any one of those will work. I'm going to use this foam block. And you're going to need a wall as well. Once you've got that, you're ready to begin. To start off, we're going to stand with our shoulder just a little bit away from the wall. And we're going to take whatever that, let's say a pillow is, and we're going to bend our knee and put that pillow right at the center of our knee. It'll make it so that we don't want to have our shoulder leaning against the wall. Once we're here, we're going to keep our pelvis level and we're going to push gently with our knee into the wall. This is going to seem really easy until you hold this for about 10 or 15 seconds. And then you're going to start feeling the burn here in your gluteus medius muscle. Keep gently pushing against the wall. We like to hold this for 30 seconds to start out with. Ideally, we would work our way up to about 60 seconds, but we'll start out with 30 seconds in the beginning, pushing this way, feeling it out here. Keeping our pelvis level. Don't let your hip jut out to the side. Right here like this. And then after we've done 30 seconds, we can switch and go other side against the wall. We'll do 3 sets of those 30-second reps. Those 3 exercises we just went over are where I start most of my patients when they have a moderate amount of glute med weakness. If as you tried the exercises in this video, you're looking for more challenge and are ready to take your glute med strength to the next level, you'll want to check out this video. It contains 4 glute med specific exercises that are all more functional and balance demanding. When you can progress through the exercises in that video without difficulty or compensation, then your gluteus medius muscles should be ready to take on any challenge you can throw at them. And as promised, here's the program that I recommend for most of my patients. I usually have my patients start doing these exercises every other day, giving themselves a day to rest their muscles before working them again. And these are the sets and reps I start people with. Of course, you can modify all of this to your current fitness levels. The most important thing with any exercise program is consistency. If you'll commit to show up for yourself every day with these exercises, you will strengthen your glute medius muscles. Also, remember that none of what we went over should be painful. And if it is, talk to your doctor so that they can help you figure out what's going on in your specific case. One last thing. Remember the test we did to see how strong your glute medius was? I recommend for my patients that they do these 3 exercises we went over in this video for 4 weeks, and then go back and test themselves with that. Most patients who have put in the work will notice improved balance, less back and hip region pain, and they'll feel more agile. I hope you'll find the same, and we love hearing about your wins and your questions in the comments below. Until next time, stay positive and know that I believe in you and the greatness that lies ahead.